Hey everyone, welcome back. I'm seriously so excited to have you here for part 5 of our Physical Therapy Masterclass Explainer. If you've been following along with us, you know we've been breaking down the complexities of physical therapy coding and billing into clear, manageable pieces. Today, we're setting the stage for a deep dive into a very specific, highly involved category of treatments. We're moving away from those set-and-forget treatments and stepping right into the active, one-on-one world of constant attendance modalities. Whether you're a clinician documenting your hard work or a medical coder making sure everything's compliant, this explainer is packed with the essentials you need. Okay, let's dive into this. Here's our roadmap for today. First, we'll establish the critical difference between supervised and constant attendance modalities. Then we'll thoroughly explore 3 specific CPT codes: 97032 for manual E-Stim, 97037 for laser therapy, and 97033 for iontophoresis. After that, we'll hit the universal coding and time rules that apply to all of them, and then wrap up with a quick teaser of what's next.
Section 1. Supervised versus constant attendance. The shift to active engagement.
So this is where we draw the biggest line in the sand for physical therapy coding. We're talking about the shift from passive, hands-off treatments to interventions that literally require your absolute undivided attention. It's night and day, really. On one side, we have supervised modalities. Think hot packs, cold packs, mechanical traction. The whole deal here is that they don't need direct, one-on-one contact. You can set them up and step away, which is exactly why they're untimed service-based codes. But then, on the other side, we have constant attendance modalities, that's CPT codes 97032 through 97039. The rule here is super strict. These require direct, one-on-one patient contact by the provider. Because you have to be so actively engaged, these are strictly timed codes. You definitely can't just hook a patient up to a machine and walk away. You've got to be physically right there.
Section 2. Manual electrical stimulation, or CPT code 97032.
All right, let's meet the first specific code in today's explainer. Manual electrical stimulation is exactly what it sounds like, applying an electrical modality to one or more areas. But honestly, the absolute key word here is manual. If you can walk away to grab a quick coffee, you cannot bill 97032, period. The clinician has to maintain direct, manual, one-on-one contact with the patient while delivering that current. This active hands-on involvement is exactly what separates it from unattended E-Stim, which you'd code as 97014. That's a supervised, untimed code. But because you're right there manually guiding the therapy, CPT 97032 acts as a constant attendance modality and is billed in strict 15-minute increments.
Moving right along to Section 3, Laser Therapy. CPT code 97037.
Now let's see how this builds on our understanding of one-on-one therapies as we transition to our second modality, low-level laser therapy. Technically speaking, this code covers the application of a modality to one or more areas using low-level laser therapy, which means it's non-thermal and non-ablative. A lot of folks refer to this as photobiomodulation. The mechanism here is just absolutely fascinating. Get this, the photons in the low-powered laser light actually temporarily create a neural blockade. It essentially acts as a localized anesthetic right at the tissue level. It pulls this off by decreasing the mitochondrial membrane potential, which then drops the inflammatory neuropeptides. It's some seriously advanced, highly targeted therapy.
So you might be wondering, when do clinicians actually use this? Well, the clinical indications and physiologic effects are quite specific. According to the guidelines, low-level laser therapy is a go-to for decreasing acute and chronic pain and inflammation. What's really notable here is that the CPT code descriptor for 97037 specifically calls out its use for post-operative pain reduction. But it doesn't just stop at pain. It literally works on a cellular level to speed up connective tissue repair. We're talking stimulating collagen metabolism, promoting wound healing, and it's even proposed to affect fibroblast function. Some research even suggests it brings down inflammation by reducing prostaglandin synthesis. Pretty wild, right?
But as incredible as laser therapy is, it's definitely not for everyone. Documenting and verifying safety boundaries is absolutely crucial here. The big contraindications for CPT 97037 include irradiating the neck region in patients with hyperhidrosis. On top of that, it's a strict no-go for patients with a history of seizures or epilepsy. Whether you're a medical coder or a clinician, you've got to ensure these safety boundaries are observed and clearly documented in the medical record before you even think about initiating this therapy. Which brings us to Section 4, Iontophoresis, CPT code 97033.
Now, what's really interesting here is how iontophoresis fundamentally changes our traditional view of a physical therapy modality. It uses a low-level electrical current, sure, but not just to stimulate a muscle or a nerve. It literally uses electricity to drive charged therapeutic substances transdermally, meaning right across the skin barrier. It's basically using an electrical push to deliver medication directly into the affected tissue. And because this requires such exact precision, it absolutely demands the constant, direct attendance of the provider.
And honestly, the mechanical technique itself perfectly validates why this skilled clinical expertise is required. Step 1. The clinician carefully places electrodes or plates over the affected extremities, prepping the site with that specific charged substance. Step 2. They apply the electrical current, which creates the physical driving force to push the drug across the skin barrier. And Step 3. The clinician has to actively monitor and adjust the level of current because, you guessed it, the exact electrical requirements vary depending on the specific medication being used. You just can't do this safely without being right there, one-on-one with the patient.
For the medical billers and coders tuning in today, these are the exact clinical indications you want to look for in the documentation. This is how you support the medical necessity of CPT 97033. Iontophoresis is specifically indicated for palmar-plantar hyperhidrosis, breaking down scar tissues, and tackling inflammatory conditions like plantar fasciitis, tendinitis, and bursitis. If you see these keywords popping up in the clinician's notes, that's a fantastic sign that this specific transdermal therapy was appropriately selected.
However, you have to be super careful because the safety precautions are extensive, and rightfully so. Since we're using electrical current to drive medication systemically or regionally, iontophoresis is strictly contraindicated during pregnancy or anywhere over open wounds and infected areas. This next one is huge. Absolutely anyone with a pacemaker or a battery-operated implant device cannot receive this treatment, no exceptions. Additional contraindications include seizures, any active hemorrhage or circulatory impairments like thrombosis or thrombophlebitis, and malignancy.
All right, Section 5. Coding and time rules, the universal takeaways.
Let's zoom out for a second. We've looked at the specific clinical mechanics of these treatments, but now let's talk about the overarching administrative rules that govern how all of these constant attendance codes are actually billed. So, the crucial point here is the number 15. Whether you're doing manual electrical simulation, laser therapy, or iontophoresis, the CPT codes in the 97032 through 97039 range are all defined in strict 15-minute increments. Each code represents one 15-minute block, meaning each code should be billed for at least one unit based on the standard CPT time rules. And because we are dealing with time-based codes here, documentation is literally everything. Our guidelines explicitly state exact times must be documented in the medical record. This is completely non-negotiable. Vague estimates, rounding up loosely, forgetting to note your start and stop times, all of that will just result in denied claims. The exact minutes you spend providing these services have to be accurately reflected right under total treatment time.
Plus, and this is a big one, it is absolutely essential to remember that the 15-minute clock only ticks when the clinician is providing direct, undivided, one-on-one patient contact. The time counted is only the time the patient is actively being treated using skilled therapy modalities and procedures. So setting up the room before the patient even walks in, leaving them alone for a few minutes while a machine runs, nope, that definitely does not count towards your constant attendance minutes.
And finally, Section 6, Teaser and Final Outro. Looking ahead.
Wow, we have covered a ton of ground today, from the energetic push of iontophoresis to the deep cellular impact of laser therapy. But believe it or not, we are just getting started with constant attendance modalities. Coming up in Part 6 of our Physical Therapy Masterclass, we'll tackle the next 3 major ones. We're going to explore the alternating temperatures of contrast baths under CPT 9734, dive deep into the acoustic energy of ultrasound billing for 9735, and break down the very specific rules for the Hubbard tank under CPT 9736. You for sure won't want to miss it as we keep building up your coding confidence.
Thank you all so much for joining me in this focused breakdown. Before you go, I want you to think about your own clinic's documentation. Are you truly capturing every single minute of your one-on-one time, or is revenue just slipping through the cracks because of vague timekeeping? Keep that documentation precise. Always remember your one-on-one time rules, and, as always, decode healthcare with Harshal.